Hello everyone, I am Dr. Atma Ram Bansal. I am working in this field of epilepsy for last almost 7-8 years. The epilepsy is a very common neurological problem. Epilepsy, also known as mirgi in Hindi, is basically a problem where a patient becomes abnormal for few seconds to 1 or 2 minutes. Abnormal in the sense that there are some sparking in the brain, because of which there is a loss of connect to the world. He or she may have bit of jerking in the body, or may have bit of staring look or unresponsiveness, but most of these episodes last only for a couple of minutes, maximum 2 minutes, 3 minutes, though in recovery there may be a bit of confusion for 5-10 minutes. There is no particular age of onset. It can start as soon as you are born and can even start at the age of 70 or 80 years. But it's more common starting in childhood age group, even during teenage group, also common in elderly. Epilepsy can present as one like a kind of GTCS, what we say, generalized tonic-clonic seizure, means sudden jerking in the body, the whole body becomes stiff, become tight, then they are jerking in the body, followed by a bit of some salivation or frothing, and then may even have some tongue bite or urine incontinence. Most of these jerks last for 1 to 2 minutes and subsequently patient recovers. Other presentation can be some confusional state. Patient may look a bit of staring look, or maybe like a statue, or maybe like an absent-minded looking at one place, not responding to whatever you are saying, and may have a bit of chewing or kind of a smacking, like these kind of movements, or like these kind of movements. So these kind of movements are known as automatic movements. The third presentation can be just face twitching on one side of the body when the patient may be fully conscious. Though in some patients, sudden fall can also be a symptom of seizure. The seizures may vary from daily to in a month to in a year, or maybe even once in 2-3 years. So it all depends upon the cause of epilepsy or cause of seizures. So if somebody is getting seizures more than twice in the life, then it is known as epilepsy. And the common cause start at the young age, means when you are born, may start with some bit of oxygen problem when you are born, like neonatal injuries, hypoxias, low sugar. Then may be related to some infection in childhood, infection going to brain causing encephalitis, maybe a common kind of worm which is there known as Neurocysticercosis. That happens from raw vegetables, raw fruits. If you are not eating properly, if you are not washing your raw vegetables, salads, fruits, then this neurocysticercosis can go in your tummy and then can go into your brain. Then head injuries, especially in teenage group, when you start driving, when you are fond of running bikes without helmet or other things, then yes, even mild head injury later on can cause seizures. Then there are many epilepsies where we don't have any particular cause. Maybe around easily 20-30% patients, we may not find any reason, and you may have epilepsy. Regarding the diagnosis of epilepsy, the most important part of diagnosis is history, means whatever happens during that event is important. So I will advise whoever is having epilepsy, or if somebody in your family is having epilepsy, to make a video during that event. If you can make a video properly, luckily because the smartphones are easily available with video facility, that recording will help us in making a diagnosis. One, whether it is epilepsy or not. Two, if it is epilepsy, which type of epilepsy. And that definitely help in treatment. Other investigations which we need, sometimes blood investigations, sometimes an MRI or EEG. EEG is basically a kind of a recording of the brain waves, and MRI shows us the brain structure, whether it is normal or abnormal. So once we have diagnosed that this is epilepsy, then starts the treatment. Treatment will depend upon type of epilepsies. Though majority of the patients we can treat with one medicine and without any major side effects, and we can stop medication maybe after 2 years or 3 years. In some patients even we can stop after 6 months or 1 year, especially in children we start stopping medicine bit early. But suppose with one medication you are not getting control, you are still having epilepsy, then in those cases we may have to change the medicine or may have to give 2 medication, and another 10-20% patient have excellent response to that combination. But in some patients this combination of 2-3 medication also may not work. These patients are known as difficult to treat epilepsy or complicated epilepsies. We do have some more workup requirement for such patients. The more workup include dedicated MRI and then a test known as video EEG. So in video EEG what we do basically is we admit the patient, we stop medication, we see, let the seizure happen and see what is happening during the seizure. At the same time the EEG is running throughout the day, throughout the night, and when that attack happens the EEG will tell us that whether it is epilepsy or not. If it is epilepsy, which part of the brain is firing. Some of the patient may not be responding due to some technical issues, like they may not be taking medications regularly, or they may not be having real epilepsy. Some of the patients have what we as a layman say pseudo epilepsy or non-epileptic events. Those patients will not respond to medications. But if it is a real epilepsy not responding to medication and video EEG showing yes one particular point of the brain is firing, and MRI is also showing that that particular point of the brain is abnormal, in that case the next best treatment option is surgery. Epilepsy surgery is a very efficient kind of surgery in the sense that if you remove that one single point of the brain, your seizures can be controlled if your seizures are not getting controlled with medications. This particular facility is not easily available, at least in India. There are only few centers. I am lucky to be part of that team which can take care of these kind of patients. We can do workup for these complicated epilepsies and can consider surgeries. We have excellent response in patients who are not responding to medications. Another treatment part is special diet like ketogenic diet that is mainly given for children. So with this we can easily treat epilepsy, we can easily control epilepsy. Medications are good, newer medications are having less side effect, not affecting much of bones, liver or kidney. Don't worry about much of side effect. If you do develop any kind of side effect, just consult your doctor. It can be changed or dose can be adjusted. Don't think of too much about negative impact of medications. Don't take epilepsy as a burden. It is not a hurdle in your success. Majority of the patients are able to live normal and healthy life. There are many historians who had epilepsy but could achieve a beautiful and successful life. One of the biggest example is Alfred Nobel, in whose name we give Nobel Prize. He had epilepsy and he was able to live a very successful life. There are many athletes who had epilepsy and had a normal athletic life. About kind of precautions or kind of safety things at home, I will advise that one is make sure that sleep is adequate, at least 6-7 hours in a go you should take sleep. Second thing is about medication. Don't miss your medication, take your medications regularly. About swimming, many people ask. I will say that you can swim, but somebody should supervise you during that period continuously. Otherwise, there are no major kind of precautions or kind of things which we should do. That is the only thing I will say. There are few things, especially about women in epilepsy, because female patients otherwise also need to have a lot of they are having hormonal issues, hormonal changes, from their beginning of life to end of life, especially in teenage when they start having this hormonal issues. Anti-epileptic drug wise, we do need to be a bit cautious that which type of medication we should use. There are certain medications which can interact, which can disturb their hormones, but newer medications are quite safe, you can easily give them. So discuss with your doctor when you are facing this issue of starting medication in females, especially young females or child bearing age group females. Then marriage as such per se is not an issue for a female with epilepsy, but only thing is you should take medicine even during marriage. If you don't tell and if you stop medication, the likelihood of seizure during marriage are very high. If you take medicine regularly, take precautions regularly, your marriage should not be a problem at all. And regarding your pregnancy or family life, with medication, most of the patients have a very healthy and a normal pregnancy and healthy baby. The chances of getting a normal healthy baby are more than 95% even with epilepsy and medications. Only thing is you need to plan it, you need to give it of folic acid or vitamin before planning pregnancy. Make sure that you are doing a detailed ultrasound in the second trimester at around 18-20 weeks just to make sure that everything is normal in the baby. And don't plan to change medication during pregnancy. If you want to change, consult before getting pregnant and make sure to take medication regularly during pregnancy. Maybe in the last trimester or just before delivery, we may have to increase your dose of medication a bit, maybe around 10-20% because of increase in weight and fluid. After delivery, which is again reduced and taken to the normal pre-pregnant level. Lactation or breastfeeding is absolutely essential for the baby. Even with medication, we advise that you should take medication and you should breastfeed your baby. Breast milk is most important part for the baby for the nutrition and immunity. Epilepsy medications are not much of amount in the breast milk, even if that is mild, and that will not affect the growth of the baby. So from female point of view, I will just say that you should be more comfortable, you should be more confident even with epilepsy and plan a normal life. Regarding children, 2-3 things I would like to say. One is development wise, allow them to develop normally, don't put too much of restriction on their playing things or going outing. Second thing is give medications regularly, make sure that medications are not missed. If somebody is vomiting immediately after taking medication or within half an hour, we do advise that you take medication again. And second thing is allow them to study well. Don't think that study will be a burden on them. Allow them to develop normal. With this, they can easily live a healthy and a normal life. Majority of our patients are leading a normal life with medications. There is one special treatment in children that is known as ketogenic diet, which is basically a kind of special diet given mainly of fats, bit of protein and very minimal carbohydrate, which is given only in some patients who are having very severe degree of epilepsy and not getting controlled with medicines. Such patient has good response. In about 1/3 of the patient, this ketogenic diet can really create magic and can stop epilepsy.